where anybody anywhere can actually download it, on App Store or Play Store, and then you call us, right, via the mobile app, or you call us via a toll-free number. Toll-free number simply means that it's free. So even if you don't have credits, yes, if you don't have data, you can always call us. So you call us, our dispatcher, based on, because all our dispatchers are medically trained, so based on the information you give, they inform you, they tell you what to even do before the responder gets there. Now they send a notification to the responder, and the responder, of course, moves on bike. There are some that moves on bicycle, but most of them moves on bike, and then gets to the location based on the information that the dispatcher has sent to the responder via the mobile application. And that solves a lot of problems, because it's not just the information of the case, but also the location, the exact location on Google Map, also the number of the person that has called, so that peradventure there's a problem or something, you can always call the person to get the exact location. And so before the responder gets there, the dispatcher is also talking to the caller to do some first aid methods before the responder gets there. Now, if the responder gets there and after resuscitation, 67% of times in an emergency, there's a need to evacuate to the nearest hospital. So, for example, let's say this time actually needs to be evacuated to the hospital. Then we also, so we have partner hospitals, right? We don't just work with any type of hospitals. We verify our hospitals, and there's a metric system that we use for that. So we inform the hospital, and then they can actually use the ambulance to come and pick the person if the hospital has an ambulance. We also partner with private ambulance services, apart from we also having our own ambulance. So if maybe our ambulance is the closest peradventure, we use our ambulance. But if it's a third-party ambulance that is the closest, we use the third-party ambulance to evacuate the person from that location to the nearest hospital, at least for the first 24 to 48 hours care.
Quite impressive there. I like that. All right, now, what are those basic things you should have around you, first aid, just in case of an emergency while waiting? Because you mentioned earlier that imagine a child fainted, the mom calls and say, I need, and you're telling the mom over the phone, do this, do you have this? If you don't understand, if you don't have it, of course, there's no way you can work with that information. So what are the basic things we can have, or those basic trainings we can have for ourselves, stuff in our house, to make sure that when this stuff happens, we can easily do our bit while the responders come?
Yes, so thank you very much. So, of course, every household should have a first aid kit. And when I mean household, I mean anything more than 5 people living, right? So let's say you have a studio apartment and another person is having a studio apartment, and then maybe there are like 5 studio apartments and it's just one of you living in each. Then maybe all of you can decide to get a first aid kit. But once it's a flat or it's a duplex, then you should get a first aid kit. Now, first aid kit, there are like basics that should be in a first aid kit, but then there are also some should I say, secondary things that may not necessarily be in the first aid kit, depending on where you are located. So in a factory, of course, because a lot of times it's maybe 4 cots. So the first aid kit that would, rather the first aid kit, okay, things, the content that would be in the first aid kit, rather, would be more of cots, for emergencies.
Okay, so what you're saying is it depends on the kind of disaster, emergency that can happen in that place.
Yes.
Okay, so that should determine what's in the box.
What should be the first aid kit. So, for example, at home, it's most likely maybe burns, like fire incident, small cuts. So, you're looking at things like bandages, cotton wools, methylated spirits, iodine, and there's some over-the-counter medications like paracetamol for the pain, also diarrhea medications, vomiting medications, and so on and so forth, right? That is very important. But apart from actually having first aid kits, there are also other things that you should have too. So, for example, in an estate, because in an estate, then we are looking at a larger population. You're looking at elderlies, you're looking at young people, you're looking at children, babies, and those are the people that are most likely will present with medical emergencies, right? So you should have extra things. For example, you can have an automated external defibrillator that can actually restart the heart itself, right? That most times happens, like helps when there's a cardiac arrest. So that's that. When it comes to skills, you want to be able to actually carry out first aid. So what do you actually do when there is a first degree burn? How do you know it's a first degree burn, right?
Okay.
Who do you call, right? What do you do when somebody is actually vomiting consistently? What do you do when somebody is having diarrhea? What do you do when somebody is itching, right? Maybe there's a bee sting. What do you do when somebody, maybe, for example, hypoglycemic crisis, jargons, but what that just means is that someone that is diabetic or someone that's actually not diabetic, there's a low sugar in the body, right? And low sugar is very dangerous. So what do you actually do when there's low sugar in the body? A lot of times people feel like these things are just medical doctors' business, but that's not true actually. We've had situations where people that we've trained have actually carried out the skills that we've given them. For example, somebody was going to Ibadan recently and there was a ghastly motor accident on the way, and then the person, because we are trained the person, oh, if there's a motor accident, it's most likely going to be trauma to the head. You don't bring out the person in some kind of way outside of the car. The person actually followed everything strictly, and then there were 2 in the car and they are alive and well today. So yes, so apart from learning the first aid skills, also learning CPR. CPR just means cardiopulmonary resuscitation, how to actually resuscitate someone from cardiac arrest or heart attack, right? Heart attack can lead to cardiac arrest anyway, so at the end of the cardiac arrest, there are a lot of people that you just say, oh, they just fell and snubbed, and people are blowing them up, crying and shouting, and it may just be cardiac arrest. So yeah, so those are the basic things. The first aid kit that I mentioned earlier, which may be dependent on location and then the content. That's first. Second is learning how to carry out first aid depending on the type of emergencies. Third is the carrying out CPR, cardiopulmonary resuscitation, and also apart from the first aid kit, having some tools, for example, the automated external defibrillator. There are other things that I may not remember out of, but yes, that's that.
All right, that's interesting. So very quickly, let's just get back to response.
Yes.
So what do you think will improve our response time in Nigeria?
That's a very difficult one because response time, of course,
there are many
factors in response time. Firstly is the distance covered, and we know Lagos the traffic wahala.
I was waiting for you to say that. Yeah.
Traffic wahala. So the thing about ambulances is that yes, very importantly, ambulances should have sirens and people should obey. Like there's a siren sound that people actually don't know that ambulance gives compared to government officials.
Oh,
right?
okay.
Yes, there's actually a siren sound that it gives.
So I just think everything is just
so when it gives that, you should actually pave way for the ambulance, because the rule about an ambulance is that there is no traffic. That's the rule about ambulance, so that the person can be evacuated fastest to the hospital. Why I didn't say faster, I said fastest because we want to get the fastest time to the hospital or to the point of care. Right, but fortunately, our government officials abuse these siren sounds, and so people cannot trust. There's this issue of trust with siren sounds. There were some ambulances that, for example, there was one story about an ambulance that the door opened at the back and the bananas came out. Wow. So some people don't even trust the ambulance. They're like, okay, do we actually know if there's somebody in this ambulance? So why do we want to move?
Imagine a place like Oshodi where people are running and you're telling an ambulance, you're telling me to pay, or a driver trying to make daily bread to pave way for an ambulance.
Yes.
Like, what's my business with you and your ambulance thing?
Bus now opens, or rather the
bananas
now opens and the bananas are coming now. No. So there's actually issue of trust, which I don't blame people for, right? So that's as regards to maybe traffic and issue of trust. But apart from that, also we are trying to solve the response time that is peculiar to Lagos or that is peculiar to Nigeria by actually training community first responders, right? So that at least there's that care. So that's why a lot of people don't understand. They feel that you need to transport the person to the hospital immediately, which is true. But what's that first care that you're actually giving the person before you head to the hospital? And so that's why first responders are located in that scene where they can actually continue care before the ambulance comes. Unfortunately, there are tools and equipment in the ambulance that can actually engage the person before the person gets to the hospital.
All right, quickly, thank you so much. Quickly, before we wrap up, I would like you to tell us about Emergency Response Africa and where you're located, how we can reach you, and maybe just call the numbers again. Just everything that needs to be known, social media handles, numbers, office address, and all of that.
Okay, so it's not everything I can remember.
Oh, but it's fine.
For example,
just go ahead.
But if you go to our website at emergencyresponseafrica.com, you will get every other thing that you need. Also, our toll-free number is, like I mentioned earlier, 08 000 2255372. So that's our toll-free number.
Is it a word? Is it a word that makes it up?
Yes, so yes, 08 000 call error.
Okay.
That's the word. So 08 000 call error.
CALLERA.
Yeah, so CALLERA. And then, of course, like I mentioned, the website is www.emergencyresponseafrica.com. Everything that you need to understand about ERA is there. So, yeah.
All right, thank you so much. And your something you called, is it your office or something you mentioned? You called
So we have our command. Yeah, we have our command center.
It sounded like a military or something. All right.
Yeah, it's actually somewhat related to
yeah,
that, because when you call us, there are some terms that we use to like reach ourselves. So we have our command center in Ikeja GRA. So wherever you call us, we are currently located in Abuja, Lagos, and Rivers, which is majorly Port Harcourt, but yeah, Rivers. So when you call us from different areas, our command center answers you. We have a lot of medical dispatchers.
Service?
Yes, it's a 24-hour service. So we have a lot of medical dispatchers ranging from paramedics to nurses to doctors that will always talk to you. Although our head office, our administrative office is in Lekki, but our command center is in Ikeja, Jerry. You will come and look for us there. Go to our administrative office.
All right, thank you so much.
That's quite informative. Like Perpetua said, the viewers, there's no toll time on iBrandTV. Thank you so much, Dr. Oluwaseun Adewumi. Thank you so much.
Yeah, thank you.
All right, I hope you enjoyed the segment. That was Oluwaseun Adewumi. He is the clinical lead for Emergency Response Africa. In all you do, please do your possible best to stay safe and make sure the next person is safe. Also, you can reach them on their social media platforms, their website, and all you need to know about them will be displayed right there, because we need you alive to watch our show every single day, you know. All right, we'll take a short break now. When we come back, we'll bring up the next segment on the show this morning. Stay with us.